And we're parroting that through the World Health Organization.
Yep.
And then the World Health Organization is praising what China did. And so
Yeah.
Italy follows suit. And look what Italy, over 30,000 people died in Italy so far versus 7 in a country that people are stacked on top of each other, 24 million. And so I'm telling you, they came upon the same solution that I came upon independently. I started treating this in March, and it works.
Okay, one of the things, so I know you've used it before, which is great. So when you realized that COVID-19 was having such a disastrous thing in America, did you read someone else who advised you to try this? This was you realized this might work.
I was in March, I was working a 48-hour shift in the emergency room, and I was distraught. Quite honestly, I was distraught. I'm a Christian, and so I was praying throughout that 48-hour shift. I'd see patient after patient, and I was thinking, God, what am I going to do if someone comes in here with COVID and they're dying? They're going to trust me to do the right thing for them, and I don't have an answer. President Trump mentioned hydroxychloroquine, and then that got shot down immediately. And so I was praying. I laid down for a cat nap between patients. I woke up convinced that God had given me a winning strategy. And you know what? A week later, I had to try it out on my first 2 patients. And for every patient, it's working. It's what Japan has stumbled on and what Taiwan has stumbled on, an inhaled steroid. They're using a different one than I'm using. The one I'm using, I think, is better. Inhaled budesonide with a nebulizer treatment. I'm also giving an antibiotic that'll cover walking pneumonia and other pneumonias called clarithromycin. And I also give zinc, because that interferes with virus multiplication. But the silver bullet is inhaled steroids. And the reason I use inhaled instead of IV is because if you give a steroid IV or as a shot in the muscle that goes total body through the bloodstream, or as pills that goes total body, every time you're turning down the immune system, the ability to fight infection. Every time you're dialing down the ability to heal. But if you use it as a targeted source, it's like one of my sons is a firefighter. If you target, they shoot the fire extinguisher at the source of the fire, at the base of the fire, and all the flames go out. This is like targeting the source of the inflammatory chemicals at the source, and all the fiery flames of inflammation are put out at the source with a nebulizer treatment. The reason I'm using a nebulizer is if you use an inhaler, 90% of the medicine never gets to where you need it. Research shows that.
Oh, okay.
But a nebulizer works.
Okay, so I'm thrilled. This is a fabulous, fabulous news. So what is the reason, first of all, you're aware of this, I know, that there's great pushing in this country. It seems to just hold off, stay home, wait for the vaccine. When you discover something like this, what do you do as a doctor when you've discovered a new treatment? How do you let other doctors know? How do you let the government know?
Debbie, I'm doing everything I can. That's why I stayed here an extra day so I could be on the news with you. So we can let the good people of Dallas know that we have solutions to this problem already. And last Friday, I got a call from Ted Cruz's office. He's heard about it.
Okay,
so he reached out to me. And so his chief of staff and another member called me, and we had a 30-minute call. I've written a paper about this. We cite 51 articles that are tried and true from established journals, well recognized journals, supporting what we're doing. And so we have sent that unpublished paper to Senator Cruz's office already. So he's responsible for the information he has now, and now everybody knows he has it.
Yes, they do.
But also, I expect next week, I understand that President Trump will also have my unpublished paper. We're, of course, going to publish it, but why wait 6 months till it gets published? Let me tell you something else, Debbie. This inhaled budesonide against COVID is currently being studied by the NIH now. Their study
That was my next question.
Their
Go
study
ahead.
will be out in October. They somehow, I don't know if they heard what I was doing, but their study will be over in October. But it's set up for failure at the start. And let me tell you how. Early detection and early treatment. That's common sense. That's the American healthcare system.
Sure.
What we're getting is what communist China has forced on the whole world. Don't wait until you're a breath away from death. Wait till the house is burned 2/3 down and then seek help.
This is what NIH is doing, you're saying?
This is what the CDC is telling us to do, and every authority is telling us don't seek help unless if you got mild to moderate symptoms. Wait till you have severe symptoms. I'm getting calls from people who go to the ER because they feel bad, and they're sent home with a positive test saying take Tylenol and tough it out at home. That is the standard of care that's being put out. That's a terrible plan for any healthcare problem, especially one that can kill you. And for 20% of the people, this is a killer. And we don't know who that 20% is, but if they have symptoms, we have something we can do about it. So the NIH is studying it. Let me tell you who else is. The country of France, which has lost over 30,000 people to this. Yeah. And Spain has said that they're going to study inhaled budesonide against COVID-19. They haven't even set their start date yet. And last week, the University of Oxford announced that they're going to study inhaled budesonide against COVID. Whether they set the study up for failure, like I feel like the NIH has done, where they're going to wait until someone. The criteria by the NIH is you have to have pneumonia and be in the ICU and be on a ventilator before they'll even give you this.
Okay, I want to jump in. So this treatment you're describing, when NIH is somewhere aware that you've been using it and have had success with patients, and that you're ascribing the same success in these other countries you've mentioned. So why would the NIH, recognize what you're claiming, why would they test it by waiting until someone who's severely ill in the hospital? What is the reason not to test it in the way that you have been, which is early on first symptoms?
Why are we doing anything that we're doing right now, Debbie?
That's not a good question.
I'm just saying, what they did in Italy was social distancing, wear a mask, shut down everything. How did that work? Let's talk about what works, which is what I'm doing, which is what they're doing in Japan and Singapore and Taiwan, and that's early detection. It's good that we're doing mass testing now. I'm telling you, at the ER that I am associated with, they're doing testing now. They didn't have the ability to do the testing in March. We couldn't. We were scrambling to find where we could even send people to get tested in March. The reason the numbers are going up is that we're having 100 times the amount of tests being done right now.
And that's a good thing.
It's a good thing. Yeah. That's what they're doing in those countries. The early detection. Hey, we do that with. We don't wait. I've actually done biopsies on people who had abnormal mammograms, and during the biopsy, I've removed the whole cancer. And the person was cured with early detection. We don't say, wait till you got stage 4 cancer and then seek help. We don't do that with any other disease. I don't know why this is being forced on us, but it's un-American. And as far as our American...
It's cruel to people.
People are dying. That's pretty cool. And beyond that, it's crazy right now that if you get COVID, you get put in the hospital, your family can't be there to be your advocate.
Yeah.
I can't tell you how many times I've, as a doctor, have had loved ones in the hospital and they hang something. My daughter was pregnant. They hang something. I say, what are you giving her? It's half in her already. And they tell me, and I said, that's not for her, and it's for the room next door. You don't have an advocate in the room with you.
Here, Dr. Bartlett.
Well, I'm telling you the truth. A family member in the room is an advocate that you are not allowed to have right now. And if you'll look at what's going on right now, if we wanted to go with science, a scientific fact by definition is observable and reproducible.
Yeah.
And so when I started hearing people say, I feel better with inhaled budesonide, that was something that I'd never heard before. I observed it, and it's reproducible. But the decisions that are made that are being forced on us, for 20 years we'd see there's an epidemic in China, and we'd see them rolling with people walking in the streets with masks. It wasn't working for them then. I don't know why it's being forced on the whole world now, that kind of thinking. Something that's working in Japan and Singapore and is working with my patients, we should be focused on science and facts instead of fear.
There's some sort of manipulation toward encouraging America to just wait it out for a vaccine. I don't know if it's the pharmaceutical companies, if it's individuals in power invested in the pharmaceutical companies, but who would be telling Americans we'd rather you die because we want you to wait for a vaccine?
It seems like people are willing to sacrifice others for an agenda. It seems that way to me because we have some solutions already that are working. There's a track record of success by many doctors in Texas. And Texas is standing out compared to other states if you look as far as the survival rate. But I think there is a lot of political motivation behind the decisions that are being made right now.
Okay, well, I do too, and I'm deeply troubled by them because I do, well, you don't have to agree with my assessment, but I'll tell you where my concern is. I think that in the first 5 today, I talked about the headlines and that, panic porn. I think there's a great agenda on the part of some in this country and many in the media that want to keep the economy damaged because of the results of the coronavirus, want to keep Americans afraid in their homes. All of that works against the re-election of President Trump.
Be afraid, be very afraid, because there's a pandemic. Oh, by the way, Debbie, we had a pandemic in 2009. It was the H1N1. And you know what? The flu strain and you know what? The flu strain that's going around right now is H1N1. Our patients that have the flu are having